gathered all my necessary equipment for this exam. I just need a stethoscope and a patient to evaluate. As I come into the room, I'm going to wash my hands and introduce myself. My name is Casey. I'm going to be the nurse evaluating you today. We're going to be doing a cardiac and lung assessment. Can I have your name and date of birth, please?
My name is George Little, and my date of birth is July 15th, 1992.
Okay, so as he's identified himself, now I'm going to begin my exam. It initially starts with just inspection, across the room inspection, as I'm talking to him and introducing myself. So I'd be looking for chest symmetry, chest rise and fall, his rate, his depth. You know, does anything look abnormal? Does he look like he's in distress? Does he look blue or anything like that I would notice just from looking? The first thing I'm going to do physically is just palpation, and I'm going to tell the patient that I'm going to put both of my hands on the top of his chest. This is going to help me feel for sub-Q emphysema, if there's any air under the tissue. And then I'm going to place both of my hands here and have him state 99 out loud for me. Please say 99.
99.
Okay, and then I'm going to do the same thing on the back. This is looking for tactile fremitus. Please say 99.
99.
And I'm going to do it on the lower part as well. Please say 99.
99.
And what I'm looking for is to see if the vibrations are the same on both sides. If they are, that's a great sign. I've already felt for the sub-Q emphysema, so next I'm going to do some percussion. So I'm going to have you turn to the side, please. I'm going to be looking for chest excursion. And what I'm going to do is I'm going to put my hands here. I'm going to have you take a deep breath and hold it in for as long as you can. And I'm going to be tapping my fingers all the way down until I hear dullness. Once I do, I'm going to mark that spot. And I've marked that spot. So now I'm going to have him take a couple deep breaths for me. Just normal breathe. And then I'm going to have you exhale all the way out and hold it as long as you can. I'm going to do the same thing again until I hear dullness. And I'm going to mark those two spots. You can breathe normally now. And I'm going to measure the distance between them. Normally it's 3 to 5 centimeters, and that's just so the diaphragm is moving in and out with expiration and inhalation. Next, something I'm going to do is I'm going to put my hands here, and I'm going to have him take a deep breath, noting the distance between my thumbs, and whenever he breathes in and out, I'm going to see if the chest rise and fall is symmetrical and if my hands move the same distance. So please take a deep breath for me. And my hands move symmetrically, so that shows that his chest is rising and falling equally. So you can turn back around. Next, I'm going to start to listen to breath sounds. So there are 3 different types of breath sounds: bronchial, vesicular, and vesicular sounds. It starts at the top and goes down. So there's quite a few spots I'm going to listen to. Every time you feel my stethoscope move, just take a deep breath for me. We're listening to the upper lobes, which is the bronchial sounds. Bronchiovesicular. You're not going to hear bronchial sounds on the back. They're mostly over the trachea. So you really want to get a good listen to those on the front. We're down into the vesicular sounds now. I want to make sure I'm getting the right 3 lobes and the left 2 lobes. And you want to make sure you listen all the way over on the axillary side, so you're reaching all parts of the lobes. I don't hear any adventitious sounds. They sound clear at this point. I'm going to have him turn again. We're going to listen to the same spots on the back. Okay, every time you feel my stethoscope move, just take a deep breath for me. You want to make sure you're not listening over the scapula. You want to make sure you're listening on the insides. Again, comparing both sides as you go across. So a lot of times people will just go side to side, so that way they're comparing the same spots. Again, you want to go all the way down and all the way over to the axillary side. Make sure you're reaching all parts of the lobe. Okay, you can turn back around. Again, I don't hear any adventitious sounds. Everything sounds clear at this point. So next I'm going to start with your cardiac assessment. We're going to be listening if you have any murmurs, which you would listen with the bell of your stethoscope. We're going to listen to your carotids. This is what I'm going to listen for: bruits. And as I'm listening to your normal heart sounds, I'm going to make sure I don't hear any other murmurs, S3 or S4 sounds. So first I'm going to listen with the bell and your carotids. Just breathe normally for me. Make sure I hear bruits on both sides. I can can also palpate the carotids one at a time as I'm doing this. Make sure I feel gold pulses on both sides. And then now I'm going to go through the normal heart sound exams. Over here I'm going to listen to his aortic valve, second intercostal space. And I'm going to go across and listen to the pulmonic valve, which is also in the second intercostal space. I'm going to move down to Erb's point. And then the tricuspid valve. And the mitral valve, which is also your point of maximal impulse. And I could feel a pulse down here too, just to make sure that everything's in the right spot. After that, I'm going to start to feel the patient's pulses. I didn't know any murmurs or gallops, S3 or S4 sounds, so I wouldn't necessarily do further evaluation into those sounds. We're going to start with brachial pulses. You want to feel them bilaterally, so that way you can tell if they're equal, the same force, depth, same rate. I'm also going to feel their radial pulses, again bilaterally to make sure they feel the same. If you know any difference, you would do further assessment into that. Next, I'm going to feel pedal pulses. So they're basically here at the top of the foot, but again, I'm going to feel bilaterally. And I'm going to feel posterior tibial pulses to make sure they're equal bilaterally. I'm also going to check for any edema. If you notice edema, you can check if it's pitting by placing 2 fingers and holding for just a couple seconds to see if it's pitting. You can also do it on the feet as well to check for any edema. I don't notice any edema. All of his pulses were equal bilaterally, good rate. Next, we're going to do a teaching. So, do you ever do a breast self-exam monthly? Have you noticed any rashes or any discharge from your breasts?
No.
No. Okay, do you do exams monthly or no?
No.
Have you ever been taught how to do an exam?
No.
Okay, so what I'm going to do is just kind of demonstrate. It's just something that you can incorporate monthly to see if you notice any differences. Males can get breast cancer as well. It is not just a female disease. So people do it differently, but there's 3 different positions that you can do this in. So whenever you're sitting, I'm going to have you sit up straight, and you're just going to have your arms down by your sides. So this is the first position that you can do an exam in. And also look at yourself in the mirror whenever you're doing this to check for any retractions or dimpling in your breasts, because that can show that there's a mass underneath your skin that is like pulling on that area that you wouldn't maybe necessarily feel. The next position, you're going to put your arms above your head and look at yourself in the mirror whenever you're doing this. And the third is putting your hands on your hips, again looking for any retractions or dimpling. Again, whenever you're doing this exam, you can use 2 fingers, and there's 2 different ways to do it. Sometimes people go up and down. Sometimes people go in circles. Make sure you feel the entire area. For males, it's very common to have masses around the areola, so that's really an area of importance to check. So I'm just going to demonstrate. You can take 2 fingers or 3 fingers, but you want to start way up here. You don't want to just start down here or in the middle. And whichever is easier for you, up and down or side to side, that's what you'll do monthly so that you have the same routine. So you'll just go and feel. I'm just going to go up and down. And you want to go all the way around, up and down, to feel any masses, any bumps. And again, just monthly is fine. You don't have to do this every day, but knowing what feels normal for you and different for you is how you're going to notice any changes. If you do notice anything, you should immediately go to your doctor and tell them about it. Or you can do the circular way, which again, you're just going to go in a circular motion. Some people work their way out, or some people go from the outside in. And just do a circular motion all the way around. See any lumps. I don't feel anything, but that's how you would do it at home, in the shower, in front of a mirror, whichever is easier for you. Whenever you do your assessment, you should always just get some kind of history on your patient, so that way you kind of know what to expect, what to hear. If you do hear something abnormal, you'll kind of know what to look for. Do you do any smoking, drinking, any drugs?
Yes, I smoke.
Do you smoke every day, socially?
I'm a social smoker.
Just a social smoker, okay. Any heart disease in your family? Have you ever had anybody have a heart attack and die young from that, or high cholesterol, things like that?
Yes.
Yes, okay. So other things I would teach this patient probably is the damage of smoking, making sure that they understand it can cause lung problems. I'd probably go over some heart disease risk factors. So of course, if his family has a long line of history of heart disease, it's really good to start young and make sure that you're eating good, you're exercising, all these things. Make sure you're doing your annual follow-up exams. A lot of times if you have a younger patient, middle-aged patient, they feel like their health problems don't start until they're older. So you'd want to just express that they should be evaluated yearly and make sure that they are following up with their doctors. So that will be the end of my exam. My patient looks great.